Alright, so for today we're going to be doing a hip flexor wrap. So to get started, I have my athlete putting a bit of tone into their leg here by having them in a semi-lunge position with a block under their foot. We're looking for about 45 to 60 degrees of knee flexion. And we're going to make sure that our athlete has their hips square to us when we're applying our wrap. To make sure that this adheres a bit better to their skin, we're going to take a pre-wrap spray, like our Tough Skin. In this case, I just have an Axe bottle. And I would spray down the area that I'm going to be wrapping. Before that, I'd be making sure to ask my athlete if there's any if they have experience with being wrapped as well as being taped, and if there's any allergies present. So then, after I've cleared those, I would take my tensor bandage and I'm going to come from medial to lateral, about halfway up the leg here, and I'm going to dog ear my first wrap around. So I'm going to bring this under, bringing the corner here. Being sure to bring a bit more tension across in the front, trying to reduce as many wrinkles as I can. Now that I'm up here, I'm going to come around one more time. Now if I can just ask you to lift your shirt up a little bit. So I'm going to palpate for iliac crest, so I can feel it here. And I don't want to go too high that I cause discomfort in the back of my athlete. So I'm just going to palpate it again. I'm going to come here, letting off a bit of tension as I come across, and coming back down. And I'm just going to continue this until I run out of my tensor bandage here, letting off a bit of the tension as I come in behind, tightening it up, loosening, and then pulling it up. Less tension. Bringing it back down. And here, because I'm low on my tensor bandage, I'm just going to anchor it off at the leg here. So if I can just have you hold the tensor bandage, thank you. And so I could just use the clips for the tensor bandage, but I'm just going to take some zinc oxide tape here. Just going to tear some off. All right, you can let go now. Thank you. Stick that down. And so, need to re-anchor that. Get a bit of a bigger strand of zinc oxide tape this time around. I can have you hold that again, thank you. Alright, here we are. Heat mold that down. And so after I have my tensor bandage applied, I would then take either our non-tear elastic tape or some ultralight. Just to save material, I'm going to be using another tensor bandage as a replacement. And so from here, I would just follow the same wrap and follow it up around the hips, back down across the thigh, back around again with the hips, and back around here. And if I can just have you hold the edge of it there for me, thank you. And again, just anchoring this off with some of our zinc oxide tape. Heat molding this down. Ooh. Here, if you can just hold that, I'm going to grab the clips instead. So I would clip this down with our zinc oxide, but just because we're working with a tensor, I'm just going to take its clips here. Right, you can let go now. Right. And so after this, I would, I'll check PMS of the distal joint. So checking cap refill of the leg. Are you able to flex the knee if you bring yourself towards me? All right. And are you able to feel when I touch there? All right.
Yes.
I would then have them begin to do sport-specific tests, having them walking and running around, and then asking them questions if they feel that there's enough restriction in the range of motion, and trying to see stability of the joint.